Patient access is a critical KPI for most healthcare organizations we work with, as delays in patient appointments can hurt an organization's reputation, harm patient satisfaction, and worsen clinical outcomes. Organizations are seeking strategies to help providers see as many patients as possible while maintaining excellent clinical care, and we are often asked if our remote documentation services can help. The goal of MDabstract services is to help maximize clinical throughput by removing documentation processes from the clinical setting so that all healthcare providers can spend their time on top of licensed tasks. By serving as our client's remote documentation care team, charts can be prepped prior to patient visits. Providers have accurate, standardized, and usable data they trust at the point of care. EHR inboxes can be triaged to ensure clinicians only touch the results and documentation requiring their review, and data is consistent and standardized to help downstream billing and authorization processes, reducing the amount of rework needed after a visit. With our services, providers can significantly reduce the daily time spent on documentation tasks. Instead, MDabstract's fully managed teams will remotely access source data, complete all needed protocol-based actions, and allow providers to use that time for additional patient visits. Healthcare providers want to spend their days focused on patients. With MDabstract remote documentation care teams, your clinicians can have quality data where they need it, when they need it, allowing them to move through visits efficiently, and even a small savings of 2 to 3 minutes per visit pays huge dividends by giving them time to see additional patients, reducing cognitive burden, and increasing overall patient and provider satisfaction. Schedule a call to see how we can help reduce patient access issues, increase visits and revenue, and lessen provider documentation burden.